Hello, I'm Essay, your AI essayist. Please note that all content, audio and video in this presentation are AI generated. As AI can sometimes produce inaccuracies, I encourage you to verify any factual information presented. With that in mind, let's begin.
Introduction. The Canon of Medicine, authored around 980 AD by the polymath Ibn Sina, known in the West as Avicenna, represents a monumental achievement in the history of medicine, a synthesis of Greek, Arab, and Indian medical traditions. The Canon served as a dominant medical textbook for centuries across the Islamic world and Europe, influencing medical practice and thought with unparalleled scope. This essay undertakes a focused evaluation of the Canon's internal claims, meticulously examining its arguments, techniques, and conceptual frameworks. The analysis will proceed section by section, with the aim of providing a critical assessment of the work's enduring significance. This evaluation will centre on the intellectual landscape within the Canon, its logical consistency, and its reception, with an ambition to illuminate Avicenna's lasting impact on the development of medical knowledge. Section 1 General Principles of Medicine Book 1. Section 1 Introduction to the Principles. Avicenna initiates his magnum opus with a consideration of the fundamental principles underlying medicine. He begins with the definition of medicine itself, presenting it as a science that aims to restore and preserve health. He meticulously dissects the concept of health, establishing it as a state of equilibrium. He posits that the body is composed of humus blood, phlegm, yellow bile, and black bile. He explains that proper health, in the context of his medical thought, is a state where these humus are balanced, which is the cornerstone for health. Deviations from this balance, hence, constitute disease. His exposition emphasizes the crucial role of the physician. Successful intervention depends on sound diagnosis, careful assessment of symptoms, and a deep understanding of the patient's constitution. Avicenna outlines the four elements fire, earth, air, and water which combine to form the humus. This concept serves as the basic structure or the fundamental organizational scheme for Avicenna's physiological explanations. His focus on the balance and interaction of these elements highlights his adherence to a holistic approach. The arguments presented within this section are, in many respects, derived from the Hippocratic and Gaelic traditions. Avicenna's significant contribution is the systematization and the refinement of these ideas. His detailed descriptions of the diagnostic methods, including the importance of pulse and urine analysis, demonstrate his precision. He outlines the essential roles of different organs and how they all work together to maintain life. His method involves observation, deduction, and the application of empirical knowledge. Section 2. The Structure of the Body Book 1. Section 2 Anatomy and Physiology. The second section of the Canon delves deeply into anatomy and physiology. Avicenna's work reflects the prevailing understanding of anatomy at the time. He provides comprehensive descriptions of the various organs and their functions. Drawing upon the works of Galen, he examines the structure of the skeletal system, the circulatory system, the nervous system, and the digestive system. Avicenna's account of the heart and its role, derived from Galen, is critical to his physiological model. He describes the ventricles, the valves, and the movement of the blood. He posits there a pause in the septum between the ventricles, an observation that held sway until disproven by later research, notably by William Harvey. He details the process of respiration and explains how air is introduced into the lungs to vitalize the blood. His description of the brain, again based on Galen, focuses on its different parts and their function. He identifies the ventricles and attributes different functions to them, including the seat of common sense and memory. His understanding of the human body is constructed from observations and interpretations developed from earlier Greek works, adapted to suit a medical practice rooted in the Arab world. The section emphasizes the interconnectedness of all bodily systems. His approach is a testament to the knowledge available at the time and his work played a pivotal role in transmitting and systematizing this knowledge for future generations. Section 3. The Causes and Symptoms of Disease, Book 1. Section 3. Etiology and Pathology. Avicenna, in this section, shifts gears to explore the causes and symptoms of disease. He classifies diseases into various categories, focusing on their origins. He identifies factors such as environmental influences, heredity, and lifestyle as crucial causes. He discusses the importance of understanding the origin of a disease to arrive at a diagnosis. He recognizes the role of external factors, such as exposure to extreme temperatures or the consumption of contaminated food, in inducing disease. Avicenna places great importance on the role of the environment, arguing that the climate and location can influence a patient's health. He examines the influence of humus on susceptibility to disease. He argues that an imbalance in the humus leads to disease states. Avicenna provides a detailed account of symptoms, including fever, swelling, pain, and discharge. He defines the specific characteristics of each of these, and also explains how to discriminate between symptoms to arrive at a diagnosis. He stresses the physician should correlate symptoms to the potential causes of the ailment. The section highlights the importance of careful observation and reasoned analysis in diagnosis. His account of the causes and symptoms of disease reflects a complex view of human health, wherein the individual is understood to be constantly interacting with external and internal influences. Section 4. The Prevention of Disease, Book 1. Section 4. Hygiene and Prophylaxis. This section delves into methods of preventing disease, showcasing Avicenna's commitment to preventative medicine. He provides detailed advice on diet, emphasizing foods that promote and preserve health. He suggests that the appropriate diet is tailored to the individual's constitution, environment, and lifestyle. He emphasizes the significance of exercise and physical activity, promoting a balanced approach. He describes the therapeutic effects of movement and the dangers of a sedentary lifestyle. He discusses the crucial role of sleep and rest in maintaining health, underscoring the need for adequate rest to allow the body to recuperate. He details the importance of maintaining a clean environment and highlights the need to address sanitation and the disposal of waste. He offers advice on mental well-being. The section underscores that a healthy mind is directly linked to a healthy body. He also discusses the role of preventive measures against infectious diseases, including those transmitted through the air and water. The preventative advice offered by Avicenna is a testament to his comprehensive understanding of health. His ideas foreshadow modern public health practices, demonstrating his foresight on preventative methods. Section 5. General Treatments, Book 1. Section 5. Pharmacology and Therapeutics. Here, Avicenna examines the methods of treating illness. He starts with pharmaceutical treatments, including the use of herbs, minerals, and animal products. He describes the preparation and delivery of a wide variety of medications, considering factors like dosage, time of administration, and the patient's constitution. He describes the method of determining the properties of medications, including their effects on the body. He places special importance on identifying the appropriate drug to suit the condition and the patient. Avicenna also covers surgical treatments. He discusses the appropriate preparation of patients for surgery. He offers techniques for wound management, incorporating practices from Greek and Arab traditions. He discusses the use of bloodletting and cupping, explaining their uses and when they should be used. He stresses the importance of applying these techniques carefully to provide the best results. Avicenna emphasizes the importance of a holistic approach to treating disease, combining pharmaceutical means, surgical techniques, and lifestyle improvements. This section exemplifies Avicenna's dedication to patient care and his systematic approach to medicine. Section 6. Simple Drugs, Book 2. Materia Medica. Simple Drugs. Book 2 of the Canon presents a comprehensive Materia Medica, providing a detailed account of simple drugs, substances derived from natural sources that are used in medicine. The section provides a systematic treatment of the properties, preparation, and uses of individual drugs. Avicenna describes the plant kingdom extensively. He classifies his knowledge of the plants to their physical characteristics, their effects, and their therapeutic uses. He details the properties of each drug, describing its taste, temperature, and effects on the body. He provides instructions on how to obtain and preserve these substances, and also describes the processes required for their preparation. He highlights the importance of the proper administration of the drugs and considers the patient's individual characteristics. He also includes information about minerals and animal products. Avicenna is scrupulous in his attention to detail. His descriptions offer valuable insights regarding the knowledge of medicinal plants and other therapeutic agents available at the time. This section showcases the development of a systematic and empirical approach to medicine. Section 7 Compound Drugs, Book 3 Materia Medica, Compound Drugs and Their Uses. This section continues the exposition of pharmaceutical treatments, taking a closer look at complex drugs, those that are mixtures of multiple ingredients. He begins this section by discussing different formulas and their functions, and providing instructions for their preparation. He classifies medications based on their functions, and describes the process of compounding them. He also considers the effects of these compounds on different parts of the body. He presents a wide range of these drugs, including specifics on their ingredients, methods of preparation, and uses. Avicenna is systematic in his description. He explores the preparation of syrups, pills, electuaries, and other formulations, as well as considerations for the administration of these medicines. He explains how these compounds interact with each other and with a patient's physiology. He makes it clear that proper dosing and careful observation of the effects are crucial to treatment. This section provides considerable information on pharmaceutical techniques, and it represents an example of the systematic approach to the classification, preparation, and administration of medicines that Avicenna championed. Section 8 Diseases from Head to Toe. Book 4 Diseases of the Body and Their Treatment. Book 4 transitions to a systematic account of diseases and their treatments, organized anatomically from head to toe. Avicenna initiates his work with diseases of the brain and nervous system. He describes the symptoms and treatments for conditions like epilepsy, headaches, and paralysis. He continues his study, discussing the treatment of the eyes, ears, nose, and throat. He describes the illnesses that affect each of these organ systems and offers solutions accordingly. He analyzes diseases of the chest, including diseases of the lungs and heart. He examines their symptoms, causes, and treatments. He then turns his attention to the digestive system, focusing on diseases of the stomach, liver, and intestines. He provides detailed descriptions of their ailments and treatments. He finishes with diseases of the reproductive system and the skin, analyzing conditions related to both. Avicenna's emphasis on identifying the root causes of ailments, combined with his methodical approach to diagnosis and treatment, demonstrates his influence on medical practice. This section showcases the breadth of Avicenna's knowledge and emphasizes his holistic method to medicine, integrating anatomical, physiological, and therapeutic perspectives. Section 9 Fevers. Book 4 Section on Fevers. Among the most important topics he discusses is fever. Avicenna considers different types of fevers and divides them into categories based on their symptoms, causes, and prognosis. He explains the different characteristics of each type of fever, including changes in pulse, signs of perspiration, and presence of other symptoms. He stresses the importance of careful observation in identifying the type of fever. He explores the causes of fevers, including the influence of the elements and humours. He addresses the role of infections and environmental factors. He identifies conditions such as inflammatory processes and the invasion of pathogens. He explains the importance of treating the underlying cause, and not just suppressing the fever. He describes different treatments for fever, including the use of cooling medications, bloodletting, diet, and rest. He provides specific instructions regarding the timing and administration of these treatments. Avicenna stresses the importance of individualized care and states that the best treatment is tailored to the specific patient. His study of fevers demonstrates his comprehensive knowledge of disease. Section 10, Surgery, Book 4. Section on surgery. Although his main focus is on medical treatments, Avicenna offers insights into surgical practices. He dedicates a section to surgical procedures and techniques. He goes into great detail regarding surgical instruments, discussing their design and use. He also describes the processes of wound management. He explains the importance of keeping wounds clean, preventing infection, and encouraging healing. He also offers techniques for cutting and suturing wounds, and discusses the use of dressings. He provides instructions on specific surgical procedures. For example, setting fractures and extracting teeth. He describes the preparation of a patient for surgery, including the method of anesthesia. He emphasizes the importance of surgical expertise and precise methods. Avicenna's discussion of surgery displays the breadth of the medical knowledge prevalent at the time. Section 11. The Practice of Medicine, Book 5, Compound Drugs and Medical Practice. The fifth and final book of the Canon addresses the overall practice of medicine, offering instructions regarding the proper methods for medical practice. He explores the roles and responsibilities of the physician. He discusses the attributes that define a successful and ethical doctor, including knowledge, care, and compassion. He provides insights on the importance of patient-physician relationships, emphasizing the need for clear communication and trust. He offers a plan to guide physicians in evaluating patients. He discusses how physicians should take a patient's history, conduct a physical examination, and analyze the results to reach a diagnosis. He also covers the topic of prognosis, explaining how to predict the outcome of a patient's illness. Avicenna offers advice on prescribing medications. He reiterates the need for understanding the properties of each drug and of adjusting dosage to the patient's condition. He also makes a note of the crucial role of the physician in patient education and presents instructions for informing patients about their condition and treatment. This section ties the entirety of the canon together, highlighting the importance of ethics and of the comprehensive approach to medicine. Conclusion. The Canon of Medicine offers a compelling illustration of the state of medical knowledge around the year 1000 AD. Its meticulous systematization of Greek, Arab, and Indian medical traditions, combined with Avicenna's original insights, reveals an astounding accomplishment. His systematic approach to anatomy, physiology, pathology, and therapeutics, supported by a thorough materia medica, established a framework for medical understanding. The work's emphasis on the interconnectedness of bodily systems, the importance of environmental influences, and the necessity of individualized treatment reflects a sophisticated understanding of human health. While some of Avicenna's claims, such as the presence of pores in the septum, have been proven incorrect, many of his concepts, including the significance of balance, the role of hygiene, and the necessity of patient-centered care, remain relevant today. The canon's extensive influence on both Islamic and European medicine for centuries is a testament to its enduring impact. The work is still relevant because of its systematic approach and its commitment to medical ethics. Avicenna's lasting legacy is that his work represented a watershed moment in medical history, influencing the course of medical thought and practice for many generations.
We really appreciate you tuning in to this AI-powered presentation. Our goal is to push the boundaries of AI in content creation, and your input is invaluable. If there's a particular subject you'd like to see us tackle next, or if you have suggestions on how we could fine-tune our AI's creative prompts, please don't hesitate to leave your ideas in the comments section. We're excited to bring you more unique content very soon.